Okay, Farah, shall we start with introductions and then people will roll in as they do? I know that a lot of people have signed up, but I know a lot of people watch the recordings. So for those of you who are joining us later, welcome. Thank you for listening to the recording. Um, so my name is Amal Ismail. For those who don't know me, I'm a functional medicine practitioner based in London. And we started these talks, Farah and I, kind of last year because we felt such a compelling need to share all the knowledge that we've learned through our experience working in the space of functional medicine, working with clients. Because this information, I wish I had it much earlier in life, because it's really transformative and it's things that you can do in order to improve your health and your well-being and those of on the people around you. So today, our topic is it's quite an important topic because cardiovascular disease is one of the number one killers in the world, and we often ignore it until the signs are too alarming. And today, what we really want to, while we can't cover the whole remit of cardiovascular disease, we really wanted to highlight how um, what are the factors that influence your cardiovascular risk and how to really assess it. So we all know about the lipid profiles, um, but there's a lot more to the story, and this is what we want to share with you today, so you can understand the pathophysiology, so how things work in the body, and then how we can assess them accurately, and then how you can how we and provide you with actionable um, things that you can do on a daily basis to reduce that risk and improve your health span. So thank you so much for being with us today.
Thanks, Amal, and hi once again to everybody joining today. I hope you're all doing well wherever you are. So, yes, this is such a broad topic, and it really highlights the importance of lifestyle medicine in preventing and even managing cardiovascular disease and preventing reoccurrence of cardiovascular disease. So, from what we eat to movement to sleep and stress, but then we're also going to be touching upon gut health and oral health, and it's I mean it's so multifactorial. Um, and we also would like to emphasize, we're going to be talking about statins. Emma will be speaking a little bit more about statins, and the fact that conventional medicine automatically puts an individual with high cholesterol on statin medication, and some of the potential negative effect of that, and how we can manage high cholesterol levels, and an imbalanced, let's say, lipid profile through lifestyle measures. And then I hope it sheds some light on things that you don't know, things that you thought you knew, but who knows? I hope we try and change your perspective on such an important topic. And it's really, it's for everybody. So it's not only for individuals in their 60s and 70s and 80s. More and more people in their 30s and 40s are starting to struggle with heart related issues because of the lifestyle that we live. So enjoy it. And we're here to answer any questions at the end. Feel free to pop your questions at any point during the talk, and then we can answer them towards the end.
Great, thank you so much, Farah. All right, I'm going to share my screen. Okay. Okay, so as we discussed today, we're going to focus on understanding your cardiovascular risk. So what are the things that influence it? How can you assess it accurately? How you can understand different patterns and how they interact with each other? And how can you modify that risk so that you can prevent heart disease? And as Farah mentioned as well, um, not just prevent first time occurrence, but prevent second, third, and so on, and reverse as well some of those risk factors. So just a key reminder that all the information shared here is for educational purposes only. We are not your treating physicians, so as such, any advice that we are given here is not to be construed as medical advice. If anything that we share here if you find interesting or you have any concern about with regards to your health, then please raise it with your primary healthcare provider, or of course, get in touch with us, and we'd be more than happy to support you. So, um, we wanted to touch on cardiovascular disease because most of you know that it's number one killer in the world. So it's an estimated 17 million people globally die from cardiovascular disease, and particularly that's driven by heart attacks and strokes. Now there's other the gamut of cardiovascular disease is quite huge. From heart failure to congestive heart disease and hypertension and so on and so forth. But today we're going to focus on the drivers that particularly lead to heart attacks and strokes. And within the other point I wanted to highlight is also cardiovascular disease is now a little bit of an outdated nomenclature, because now we think of it as cardiometabolic, because we now understand much deeper the role of insulin resistance in and comorbidities associated with insulin resistance, and its impact on cardiovascular health. So we covered that in our last month's talk. So I encourage you to listen to that, because that's a really good foundation and segue into what we're going to discuss today. So, how are heart attacks and strokes driven? So, normally, the highest really factor, or the highest cause, is normally unstable plaque that can rupture inside an artery. So or you can have erosion of the endothelial, which is the lining of your arteries and veins, or you can have calcification. So you have calcium deposit and then start to literally poke through the endothelium, or you can get breaking through of the endothelium that causes exposure to thrombogenic material. So you end up with coagulation that creates a clot that can move, and that can cause a blockage somewhere down the line and cause a stroke. And you also have you can also have an imbalance in your immune system, where you have elevation of the Th17 cells, which are pro-inflammatory, and then reduction in your Treg cells, which are anti-inflammatory, and that results in increased risk of heart attacks. So these are the common sort of drivers of cardiovascular disease. But what are the important thing to think about is, and I encourage you to listen to a lot of Dr. Harmon's podcasts that are on the doctor's pharmacy, because he tackles a lot of these points, which is, when we treat heart disease, we only focus on, okay, well, cholesterol is high, let's lower it. Blood pressure is high, let's lower it. Blood sugar is high, let's lower it. But this is really not a solution, because, as he says, it's like mopping up the floor while we have a leaky faucet that's running, and the sink is constantly overflowing. So we have to really deal with the root cause, because ultimately, what happens when we're dealing with cardiovascular disease, someone comes into the office, to the clinician's office, and they see that they have elevated cholesterol, maybe slightly overweight, and then they'll say, "Oh, we should be on a statin." But what it feels like is you're kind of patching a leaky tire, and that's not going to go far, because we all know that eventually you'd have to change that tire. So we want to avoid that long-term complications, with more medications, surgeries, and so on. Reduce that risk of mortality and morbidity by addressing the root cause. So we want to go to the why. Okay. That's really the premise of functional medicine. We're always asking why. We want to get to know the root cause of what's driving this illness. So we're kind of changing our perspective and thinking from this organ-based silo thinking. We're just going to deal with the cardiovascular system and forget about everything else, and move into more of an interconnected system, where we're looking at the gut and the kidneys, and the structural integrity and the liver, and so on and so forth. So we're really kind of moving towards a human ecosystem. And this is how in functional medicine we address cardiovascular health, is by really looking at it from the perspective of this interconnected sort of wheel of systems, bodily systems. So just to kind of break it down to you in a very easy way, because we tend to refer to it quite a lot. I just wanted to take this moment. So transport is really the topic of our discussion today, which is the cardiovascular and lymphatic system. But really, when we start thinking about it, how the body's interconnected, this is how it works. So what does our body need to live? It needs oxygen, amino acids, minerals, vitamins, phytonutrients, antioxidants, fatty acids, cholesterol. And how do we get that? We get that through assimilation. So that's through basically ingesting food, digestion, absorption, and through the microbiome, and of course, inhalation, air and oxygen through the nose and the lungs. So once we have assimilated, how do these nutrients, the really important nutrients, get to where they needed? They need transport. This is where the cardiovascular lymphatic system comes into place. So water soluble nutrients would easily go through blood flow, and then gas and oxygen needs to bind to hemoglobin so that it can be carried around. And then fat soluble substances normally need the carrier to take them around, which we're going to talk about cholesterol, how it's being carried around the body. Um, but in order to properly transport things around the body, we need something to hold it together, and that's where structural integrity comes into place. And this is what basically holds the vessels and the organs and the tissues together. And the cardiovascular system then uses pressure to move nutrients throughout the body, but we have to protect that structural integrity. So how do we do that? The body does that through defense and repair. This is our immune system, and this is where it protects foreign invaders from continually penetrating our defenses, which is our structural integrity, whether we're talking about an organ or the gut, or we're talking at a cellular level. And also the body is always breaking down and rebuilding. There's wear and tear, so that's what defense and repair does. But as the immune system then labors in the background, how does the body converse with itself to say, hey, I'm needing some cholesterol here, like the ovaries shout out that they need some cholesterol in order to make some estrogen or testosterone and so on. Then what happens, that happens through our communication node. So this is basically our endocrine system, our neurotransmitters, our cytokines, which are the immune messengers. So different parts of the body use these communication molecules in order to send messages between all the different systems across the body. And then what sustains all of this necessary function is our energy, because all of this work requires a high amount of energy, and especially the cardiovascular system. So remember, we talked about mitochondria in the past. So these are the little organelles inside all of your cells that essentially, think of it as the factory that generates energy. And without it, we die, because we need it for the body cannot function without ATP. That's the energy currency of the body. So if mitochondria is defective, then we have a disease occurs because we're unable to sustain the functions of the body. And we talked about this last week in insulin resistance, how mitochondria plays a very big role in the type of insulin resistance that you can develop, whether it's faulty mitochondria or low numbers of mitochondria. We also talked about it in fertility, and we talked about it in a lot of the topics that we've covered. So it's a really important one. So the liver, the gut, the kidneys, and the microbiome are always, require a lot of energy. But the highest user of energy is really the brain and the heart and the muscles. So really important for the cardiovascular system that we have good mitochondrial health. And then what sustains all of these, and then what helps all of this operate in a smooth fashion is our biotransformation and elimination. So all of our organs are constantly detoxifying. They're producing waste. The bacteria in our gut is producing waste. And then this is where the colon, the kidney, the skin, and the lungs, they work really hard to eliminate all of that, to make sure that the body stays in a very good homeostatic balance. And what is at the heart of this? This is really critical. What sits at the middle, what holds all of it together, is our emotional, mental, spiritual health. Okay, without that, we also are going to suffer. So I have a lot of patients who might have cardiovascular disease or autoimmune condition, and we do everything right to correct the imbalances around the nodes of the matrix, but then they don't get better. And the reason why is because they're experiencing a major trauma, they have really high stress, they lost their job, they're going through a divorce, they're in an abusive relationship, whatever the reason is. So we really need to really focus on that aspect as well. So let's focus on transport as this is our key topic today. So when we think about transport, which kind of for us is the cardiovascular system in the functional medicine world, we think about vascular health and integrity. So we'll think about the arteries, the venous, and the lymphatic system. We think about metabolic health, which is insulin and glucose, and we covered that in detail last month. And then we think about intracellular, so inside your cells, the balance inside there. If there's inflammation, if there's oxidative stress, if there is challenges with mitochondrial function, that's the electron transport chain, then we are in trouble because that's going to increase the risk of heart disease. And the major risk factors that are commonly drive heart attacks, strokes, high mortality, basically from heart disease, is dyslipidemia. So that's imbalance in your lipid profile, inflammation, oxidative stress. That's when you have high toxic load in the system, and the body's unable to clear it effectively. And then you have automatic or autonomic dysfunction, and that's where the HPA axis is out of balance due to stress or trauma or infection or so on. So we can't cover all of this today. I wish we could, but each one of them is going to require a whole session. We're going to touch upon them a little bit, but the most important one that we're going to cover is dyslipidemia, because that's the most common thing that you get tested for in the conventional setting. So myth number one that I want to handle when it comes to dyslipidemia, it's everybody thinks that high cholesterol is the enemy. Okay, everybody's obsessed that cholesterol needs to be low. The lower, the better. But actually, in truth, low cholesterol can also be a really big problem, because you need cholesterol to make so many things. You need it for the integrity of your cell walls. You need it to make bile. You need it to make vitamin D. You need it to make all your hormones. So without cholesterol, we're gonna suffer. So when often I see patients with a cholesterol level below 150, I get worried, because then we know that's going to have a detrimental effect on other parts of their ecosystem. So low cholesterol can lead to suicide attempts, depression, impulsive behavior. You're also, as I mentioned, you're not making hormones. You won't make hormones effectively. And women, for example, with low cholesterol, they have, I believe the research was, they have 16 times greater risk for attempted suicide than women with normal cholesterol. There's an increased risk in mothers with low cholesterol to have preterm birth babies. Because really cholesterol is the building blocks for so much of your body. And some of the nutrients, like as I mentioned, vitamin D, it needs cholesterol. Bile, so that you can break down fat, is needed, requires cholesterol. So it's essential. It's also essential for coating our nerves in the brain and to assure that messages get sent through. And so we also see that cholesterol imbalance has an impact on cognitive function and Alzheimer's. There's a particular risk factor there. We don't have time to talk about it, but I can answer questions in the Q&A. And really, the when cholesterol is low, it's not always better. Cholesterol becomes really problematic is when it's damaged by free radicals. So basically, when it oxidizes, when it becomes rusty, when it develops rust, when it's rancid. And this really happens when you have underlying inflammation in the body. And these are things like lack of exercise, high intake of sugar, belly fat, stress, poor sleep, and environmental toxins. A lot of things that we've covered in our past talks, all of these drive inflammation, and inflammation really becomes the root cause of many of the problems that we face, because then it drives insulin resistance, and insulin resistance then it drives all the issues that we discussed last week. So let's kind of just give you a bit of a understanding of how cholesterol is metabolized. So how do we make it? So cholesterol, 20 to 25% of it is of its daily cholesterol that you need is produced in the liver. But there's a high production also produced in your intestines, in your adrenal glands, and in your reproductive organs. So you can see where things that, if you have imbalances in your adrenals, your intestines, or your reproductive organs, you will end up with impact on your cholesterol levels. The production of it is stimulated by so it basically, if you look at this diagram, it's produced produced through this enzyme called HMG CoA reductase. And this enzyme is the rate limiting step. So if it's working fast or slow, it's going to have a significant effect on cholesterol, and of course downstream effects. this is really stimulated by leptin and insulin. And we talked about leptin and insulin last time. So leptin is your satiety hormone, insulin is your major metabolic hormone. And so um, if this is why when we have high carb diet or high sugary diet, or we have poor sleep, we end up with elevated cholesterol, because we end up with worse insulin and leptin levels, unregulated insulin leptin levels, that essentially drive HMG CoQ reductase enzyme to produce more cholesterol. And this is, by the way, where statins work. So statin works by blocking this HMG CoA reductase enzyme. So you can see why it's effective in a sense to block cholesterol production when it's really elevated, but then we end up with all of these side effects. And then it's also suppressed by, I'm not going to cover this because this is related to um, fatty non-alcoholic fatty liver, but essentially it's also impacted by those lipid by the LDL receptors. So the second myth I wanted to address is the one related to statins, because we often think that statins is really the most effective way to reduce cholesterol. Well, in fact, so if, for those who don't know, statins are the drugs that treat high cholesterol. They're the second most commonly prescribed drug in the whole world. Now, why is this a huge issue? I'm not saying statins are bad, but we have to really have a personalized approach for treatment. But statins don't come without side effects. So they can increase your risk of developing type 2 diabetes. They can cause muscle pain. They can cause sexual dysfunction, again, because we end up with low estrogen and testosterone. It can impact cognitive dysfunction. It can lead to cognitive dysfunction. And there's lots and a plethora of research now that's published on this. And they can also impair the ability of your body to produce energy, because they damage your mitochondria. So they knock out the pathway in the body that is responsible for producing also some of your sex hormones, and this leads to all sorts of hormonal imbalances. So really, statins is low T, low testosterone is commonly seen in patients who've been on statins for a long time. You also see deficiency in CoQ10, which is again really important for energy production. So are they the only thing that we can use to reduce risk factors? No. So actually, research shows that daily consumption of dark chocolate has been shown to reduce risk of heart disease by 45 to 77%. And the side effects are good because it's so delicious. And a handful of nuts a day may reduce your risk by 20 to 30%. Drinking a liter of olive oil a week, same thing, about 30%. So there's a lot of lifestyle things that we can apply. Of course, it needs to be personalized because everyone's underlying health is different. So we need to really treat things holistically. And one of the most worrying facts I always see is that actually more than 50%, and there's like varying research data here, but somewhere between 50 to 75% of heart attacks that lead to sudden death happen in patients with normal cholesterol levels. And we still treat with a statin. So really there's something else going on. So what's really the missing link? The missing link is that the standard lipid panel that we look at, which is normally looking at total cholesterol, HDL, which is the good guy, LDL is the bad guy, and triglycerides are and inflammation markers like high sensitive CRP. Um, they normally that's what we look at is really not the full story, because that first number, the high cholesterol, where everyone is the cholesterol, total cholesterol, that we tend to be obsessed about, doesn't really tell us much because it lumps HDL and LDL together, the good and the bad, and it's a really the story is a lot more complicated than that, and it doesn't really differentiate between particle size and number and the types of HDL versus LDL. So let's kind of explain to you a little bit. So like other lipids, cholesterol has low water solubility. So it's, if you put oil in water, you see it doesn't really go anywhere, it floats. So how does it move around the body? The way it moves around the body is through LDL and HDL. These are called lipoproteins. So LDL, low density lipoprotein, is known as the bad cholesterol. And it technically is the car that takes cholesterol away from the liver to the rest of the body when it's produced as needed. And there are some different forms of LDL which vary in impact. Not all LDL is bad. And essentially, LDL is important. Now, HDL, on the other hand, is the good cholesterol. And what it does, why is cardioprotective and it's a good cholesterol? Because it sweeps up like a vacuum cleaner all the cholesterol from the arteries and delivers it back to the liver for processing. So it prevents that deposition in the arteries. But sometimes you can also have dysfunctional HDL. So the message here is that when it comes to cholesterol, size matters. So it's not just about the total value. Okay, so um, if you look at this screen here, you have Jerry, you have Susan, David, and Maria, and they all have on a blood panel the same LDL value, which is 125 milligrams per deciliter. So somebody might look at that and would say, "Oh yeah, they're fine. They don't really have a very high risk." But actually, when we dig deeper and we look at the particle size, then we see that Jerry has big fluffy particles, while Maria has very small little dense particles. And these small dense particles tend to be stickier, and so they can cause clots, atherosclerotic clots in the arteries, atherosclerotic plaque in the arteries much quicker because they kind of go between the cracks. And so she is a much higher risk than Jerry. So LDL particle number and size is really important. And people with, like Maria, with a small density, have a small dense LDL, they have a 1.7 times increased risk of rupture. So, and this small number this small LDL has a greater chance for oxidation, rusting. Rusting is bad whether it's in your car or at home. It's certainly in your body, it's bad. There's also LDL can also get glycated. So if you eat high amounts of sugar, it can become sticky, and that also makes it even more and more stickier. So the conventional goal of lipid lowering treatment is normally to lower LDL. However, it's really not. This is it's not really, doesn't really tell you much, and doesn't actually tell you it relates to the severity of insulin resistance that we touched on last time. So it really needs to become considered the primary goal of therapy is that LDL particle size number, because it has a stronger association with cardiovascular disease. So I just wanted to show you here in patients with visceral adiposity, so a lot of fat around organs, who have metabolic syndrome, so they are on that insulin resistance scale. If you look at a normal patient, they're very low density lipoprotein, and their LDL and their HDL kind of look normal size and normal numbers. But then when you add insulin resistance to the picture, what happens is you increase the risk, because insulin resistance changes the particle size and number, and as a result increases your risk of developing heart disease. So I just want to show you two patients of mine in the clinic where I used those advanced panels. And you can see here, let's look at this patient, 65 male with type 2 diabetes on a statin therapy with normal total cholesterol levels, right? So if you looked at a normal panel, you would only see what's here on the top left corner, right? So we look at it, we'll say, okay, his HDL is low. And so, we want to encourage him to exercise because the HDL is very responsive to exercise, but the total cholesterol is good, but the triglycerides are elevated. A key point here to remember is actually the ratio between triglycerides to HDL is really more important than the numbers on their own, because that means if the ratio is over 2, that means you have carbohydrate intolerance, and that which means that you need to focus on a diet that's higher in fat and low in carb. So there's a lot of nuances in lipid metabolism, but that's why it's really important when you work with your practitioner, ask for an expanded panel so you truly understand what the risk is. So you can see in this patient, his risk is really high, because if you look at his particle size number, it's very high. And then when we look at the size, they're small. So they're small and a high in number, which means the chances of developing plaque is really risky, and of course rupture. You can see also his inflammatory markers are high. His hsCRP is elevated, and homocysteine is elevated. So homocysteine is a risk factor for atherosclerosis and Alzheimer's. It's normally elevated if you have deficiencies in B6, B12, and folate. Also, if you have genetic SNPs, so variation in the genes responsible for methylation and detoxification. And what it does, it accelerates the formation of plaque, and it also causes hypercoagulation. So it's really important to measure that. And most conventional labs can do homocysteine, so definitely ask for that at least as a minimum, because that's another independent risk factor. And fibrinogen is another one, but that's again, he has it. It's not elevated here, but again, this is a very high risk profile patient, even though his total cholesterol is normal. If you look at this patient, well, she's a 60-year-old female with blood pressure, but she has normal total cholesterol, normal LDL, normal triglycerides, and low HDL. So she's slightly overweight. And you could look at this from a conventional lens and say, well, you're fine. Just make sure that diet and lifestyle, maybe just focus on exercise to bring your HDL. But when we dig a little bit deeper and we do the expanded panel, we see that she has very high particle numbers. Good news is they're from the large size, so that means they're fluffy and they can bounce around. But we can see that her fibrinogen is really elevated, and that's an independent risk factor because it increased. When that's elevated, it's really a response to there's a tissue injury or damage. And in fact, this patient had severe infection in the abdomen, and there was tissue injury, so fibrinogen was elevated. But you can see her homocysteine is severely elevated as well, and she has insulin resistance. So you can see that when we look at this expanded panel, we can really have a better idea of where the risk factors are, what's driving them, and how do we treat, because the treatment for this patient is very different for the treatment for this female patient. Okay, so the good news is that 80% of these premature deaths from these causes can easily be avoided by modifying lifestyle risk factors like diet, exercise, reducing visceral fat, treating any chronic infections, including imbalance in the gut flora, removing any toxins, improving sleep, and reducing stress. So let's focus on a couple of key areas where you can to understand how these influence your cardiovascular system significantly. So inflammation, we know, is really the first and foremost issue that then triggers a lot of problems. But inflammation, often, where does it start? It really starts in the gut or the mouth. Okay, so this is a very heavy slide. You can read it at your own time. I've also provided the references, but essentially. What I want to show you is that the gut, if we have imbalance in the gut flora, or we have a breach in the gut barrier, so we have a leaky gut, then that's really going to contribute to increased risk of cardiovascular disease. Okay, so things like reduced dietary fiber, reduced level of butyrate, short chain fatty acids, they all lead to leakage of the lipopolysaccharide. We talked about this in previous talks. So this is the toxin that's produced by bacteria. It leaks out into the bloodstream. It drives systemic inflammation, and that has a negative effect on plaque formation and cardiovascular disease. What about the oral health? So oral health is really, really important for cardiovascular health. And there's been also a lot of research in this area. And now you can see there's a rise in all these functional dentists because they're looking at the mouth as a gateway to health. So we're not just, when we treat the oral cavity, it's not in isolation. So how does this work? So oral flora um, uh, forms these gingival biofilms. So basically, it's like the bad bacteria kind of hides under these little tents, these biofilms, and it initiates this process of periodontal disease, inflammation, and it lead to some bone loss, so enamel loss, and some pocketing of inflammation. And what happens is then the toxins, the enzymes, and the metabolic byproducts produced by this gram-negative bacteria that's living inside those biofilms, it starts to cause necrosis and damage to the epithelial lining of your mouth. And then what happens is, if you see in point 3, is then this epithelial breach leads to when it's breached, all of this then invades the tissue and the blood vessels, and then you have this like toxic slew going on. And then once they get into the bloodstream, that is going at number four, it triggers a host of immune system responses, and you end up with a lot of pro-inflammatory immune molecules, cytokines. And so what happens is then this these then go to the liver and they stimulate this acute phase proteins. This is when your CRP is elevated, your fibrinogen is elevated because now there's tissue damage, and this all of it combined is going to lead to atherosclerotic disease because that's now going to impact your lipid levels, particle size number, and oxidation. So whether they're oxidized or not or glycated. Abdominal obesity is another really important factor in driving imbalance. So this is again a really great study that shows how how abdominal obesity, so fat in the abdominal region, can drive cardiovascular risk. Again, this is really complicated, but I don't want to go through it in detail, but ultimately you can see that it drives inflammation, it drives insulin resistance, and this is what eventually leads to increased risk of cardiovascular disease because it worsens markers of cardiovascular disease because you will have more LDL that are small in number. This is driven by this ApoB. I'll explain it in a second. Your C-reactive protein is up, your inflammation is up, and so that's going to lead to damage, plaque formation, and rupture. So, what about the psychosocial spiritual considerations? So, that center of the matrix that we talked about, this is really important. Warning signs to remember that you're heading, kind of towards the cliff. If you have loss of focus and mental clarity, if you have a lack of ability to relax, have active rest or sleep, if you have feel like complete loss of self-esteem, or you're feeling tired and on edge, that's a sign that you are in sympathetic dominance. Okay, you're stuck in this fight or flight response. And again, stress in itself results in a massively increased risk of cardiovascular disease. So you have constriction of the vessels, you have increased clot formation, you have increases in your inflammatory markers, CRP, fibrinogen, homocysteine. You have more fat, so you end up with more abdominal fat as a result of stress. You end up with atrial fibrillation. You end up with something called also the broken heart syndrome. Patients who feel like they're having a heart attack, they go to the hospital, to A&E, and then they say, you know what, you check out. Actually, that's a sign where the left ventricle is contracting so hard that it mimics the feeling of a myocardial infarction. And that is not a good thing. And that's really happens in people who are experiencing severe emotional stress. It also can worsen congestive heart failure. It reduces heart rate variability, which is a sign of your resilience. And this is a great predictor of sudden death. When I used to see patients in the clinic, I used to actually measure that in a very sophisticated equipment because that gave me a very good predictor of where they are in terms of their risk factor. It also reduces resistance to infections because it alters the immune system and it can cause an MI. So the key message I want to highlight for you here is you really want to know your risk status. Okay, so if you have any three of the following five risk factors listed here, so if you have an increased waist circumference, if you have blood pressure that's more than 130 over 85, or you're taking hypertension medication, or your fasting blood sugar is over 100, or your triglycerides are over 150, or your HDL cholesterol is really low, when you've lost your cardioprotective effect because there's no garbage trucks to carry all of this cholesterol that's been dumped everywhere, then just having three of those means you're at an increased risk of heart disease, and you need to start doing something about it because all of this is modifiable through lifestyle. Okay, so what we're trying to think is we want to prevent this kind of flame effect from taking hold. So, we kind of start at BMI, glucose, lipids, and blood pressure here. We start at measuring here, but ultimately we want to go backwards in functional medicine. We're trying to find the cause to understand how can we stop this domino effect from happening in the first place. So where do we focus on? We focus on, as we've discussed many times, we look at genetic predisposition. We're really trying to see the wood from the trees. We're looking at, are you experiencing chronic stress? Do you have any chronic or low grade inflammation? Do you have any visceral adiposity? Do you have any nutrient insufficiencies that can drive elevation in homocysteine, for example? Do you have a high glycemic load and as a result insulin resistance? Do you have dysfunction in your mitochondria? Do you have poor aerobic capacity or reduced, decreased muscle mass, and smoking? By the way, decreased muscle mass is a really important factor, especially in the elderly. Which we stop training, we stop doing resistance training, which becomes actually more and more important as you age, because muscles, having good healthy muscles promotes health span and decreases inflammation. So, oop, yeah. So, what are the foundational testing in functional medicine? We look at, uh, uh, BMI. We look at your weight, waist circumference, and weight to hip ratio. We look at the expanded panel. So this is really important. I'm just conscious of time, so I'm going to not going to cover this in detail, but you can ask me more questions. All the optimal ranges are here. But really, when you're testing for your cardiovascular risk, I encourage you to do this full panel, because that really gives you a very good idea of where you're at. Working with, of course, a practitioner that can make sense of this and give you a much more personalized risk assessment and an approach to preventing cardiovascular disease. So there's some things I didn't talk about, like LP(a) and stuff, but we can cover that in the Q&A. And then we look at the root cause. So remember, in all of our talks, and what I highlighted here is we want to look at the gut microbiome, because any imbalance there is going to drive significant inflammation, insulin resistance, and influence actually cholesterol synthesis, because a big part is carried out there. I'm going to look at nutritional deficiencies, because those can be a driver of increased cardiovascular risk. We're going to look at adrenal stress by measuring that 6-point salivary cortisol. We're looking at hormones, because actually hypothyroidism increases your risk of cardiovascular health, because it increases the number of LDL particle sizes and makes them smaller. We look at genetic SNPs. Of course, we also look at mold, heavy metals, organic toxins. All of these toxicities actually increase your risk of atherosclerosis, because it impacts your ratio of lipids. So it does drive dyslipidemia. And then we look at your hepatic capacity to detoxify. And so we really treat with a food forward approach. We target insulin receptivity, because that's really important that we have healthy insulin response. We support, because without it, we end up with lipotoxicity and glucotoxicity, which this is how we end up with worse lipid profile. We support the inflammatory state, with lots of antioxidants, and we manage hepatic function. We want to make sure the liver is functioning effectively. It's doing its job in biotransformation. And we emphasize lifestyle modification, like stress, like sleep, like exercise, and nutrition. So Farah is going to go into this in detail. But really, the key message is that Dr. Sullivan had published this back in 2006, and when he was looking at the interaction between genes and the environment. And the point is that our genes really haven't changed much, but our environment has. So the theory is that this kind of explosion of cardiometabolic syndrome is a manifestation of this profound mismatch that we have between our present environment and previous circumstances that have molded our genetics. So our genetics evolved as we needed in the past, but as our environment changed, it now we have a mismatch, and so instead we end up with a negative epigenetic expression of our genes that drives more illness rather than wellness. Sorry, that was a quite a quick whistle stop, but thank you so much for listening to me. I hope this gave you a lot of things to think about. And of course, I'm happy to answer questions after. I'm going to pass on to Farah, because she's going to talk about the most important modifiable factor that you can start with, which is nutrition.
Amal, that was excellent. Thank you so much.
You're welcome. I feel like I was
It was
talking at the
so
speed of light.
informative. So I wanted you to talk for longer and longer.
Thanks, Farah.
Okay, let's get started.
Yeah, go ahead.
Yeah. Okay. I hope you guys can see my screen.
Yes.
Okay. So again, my disclaimer, which is, of course, nothing is meant to treat any condition you might have. So any recommendations I give, please always, in order for it to help you and for it to be personalized, please work one-on-one with someone um, who you trust and who is a functional medicine expert. Another disclaimer is please don't blame me if after this presentation you feel super hungry because I've got tons of food photos, healthy ones though. So Emma did mention the importance of running comprehensive lipid testing. And when it comes to addressing any imbalances, it's so important to look for a trend. We cannot just treat one number. And I have so many friends, family members, and clients who freak out when they see that their cholesterol levels are high, or their LDL levels are high. And it's really important to look at the overall picture. What are the HDL levels? The LDL levels, is it the small LDL particle size? Is it the large LDL particle size? The larger ones being more protective or more cushiony, so they're more protective. So again, we cannot just isolate one value. We need to look at an overall picture, and it's important to look for a trend, but also to consider other lifestyle factors as well. So things like age, gender, hormonal imbalances that can also predispose or can also increase the risk of someone in terms of cardiovascular disease. Okay, so a lot of nutritional deficiencies could be linked to dyslipidemia and as a result cardiovascular disease. So some of these nutrients, for instance, magnesium, vitamin C, vitamin D. So vitamin Sorry about that. So, for instance, vitamin D, and again, the vast majority of us are deficient. So, a deficiency has been linked to dyslipidemia. Vitamin C, we know, is a super antioxidant, and it can really help prevent the oxidation of LDL. So, LDL, again, if you have an elevated LDL number, we really need to look at a deeper level to see what about the oxidized LDL, because having oxidized LDL, this is really where the problem lies. So in order to prevent LDL particles, for example, from being oxidized, we need certain nutrients, magnesium being one of them, vitamin C as well. Manganese is really important in terms of a production of glutathione, which is also believed to be the master antioxidant in the body. Chromium, for example, is really important when we talk about insulin resistance. Coenzyme Q10, again, if someone's on statins, they should be, educated in terms of supplementing with coenzyme Q10, because that can be depleted, and as a result, they can feel very fatigued, and energy production in general can be compromised. Selenium, also needed for the production of glutathione, but it's also, in general, it could affect the oxidation of LDL. So micronutrient deficiencies can be associated with dyslipidemia, but then also having dyslipidemia can further increase the risk of micronutrient deficiencies. So this is really where food as medicine comes into play. And when we focus on a diet full of whole foods, it's really centered around including functional foods in your day-to-day diet. So what are functional foods? Those are believed to have extra benefits to their normal nutrition or their normal, let's say, macronutrients, their fiber, their protein, their fat, and their carbohydrates, as well as their micronutrients. It's really hard to focus when I have my daughter cycling around the house. Apologies for that. So functional foods, again, are believed to prevent cardiovascular. Sorry about that. So functional foods are believed to, or have been shown to prevent cardiovascular disease by lowering lipid levels through their anti-inflammatory and antioxidant properties, by reducing the oxidation of LDL, by promoting or increasing HDL, and reducing homocysteine levels. So again, functional foods, whether they are plant-based foods, or the majority of them being plant-based foods, are really important for us to include on a day-to-day basis. So some of those are curcumin. So functional foods contain bioactive compounds which exert these biochemical, physiological health effects in our body. So, for example, we know turmeric. Turmeric has been shown to be a fantastic anti-inflammatory, immune-boosting food or spice, and the active component or the bioactive component is curcumin. Cinnamon, which contains cinnamaldehyde, broccoli, which is very rich in sulforaphane, particularly broccoli sprouts as well. And really, the sulforaphane, we activate myrosinase, the enzyme which can produce sulforaphane when we chew, when we chop up broccoli. Avoid overcooking broccoli as well. I'll talk about that later. But the best way to really maximize sulforaphane content is to steam it just for 2 to 3 minutes to maximize the sulforaphane content. Resveratrol, so your grapes. Quercetin, which is believed to be a natural antihistamine. We find that in apples and onions. Capers are a fantastic source. Tomatoes. Allicin is the bioactive component in garlic. ECGC, which is the bioactive component in green tea, and green tea has really been demonstrated to have such strong anti-inflammatory properties, which can also potentially reduce the risk of CVD or cardiovascular disease. And then omega-3 fats and other bioactive compounds, which we can find in fruits and vegetables. So those particular foods, in addition, so dark chocolate, legumes, whole grains, fruits and vegetables, those contain things like fiber, polyphenols, which can all help reduce cholesterol in the body. So for example, fiber-rich foods, again, coming from whole grains, coming from legumes, your beans, your lentils, your chickpeas, can help bind to cholesterol in the intestine and therefore prevent it from being absorbed. Polyphenols have such strong anti-inflammatory and antioxidant properties, which can really help, in general, prevent cardiovascular disease, but also reduce cholesterol. Omega-3 fats, I will talk about in a little bit. It's a bit crazy on my end today. I really apologize for that.
Do not worry about it, Farah. Do not worry about it.
As you can see in here. Okay, so homocysteine. So I think you're going to see a trend. You're going to see a trend, more plant-based foods, more fruits and vegetables, more nuts and seeds, more, whole grains, staying away from refined sugars. And those can all promote or reduce the risk of cardiovascular disease through promoting reduced cholesterol absorption, through reducing homocysteine. So Amal did mention the importance of homocysteine, the importance of B vitamins, and methylation in terms of homocysteine. So we can help reduce homocysteine through food as well. So usually, we recommend an individual to supplement with methylated B vitamins, but also through dietary measures as well. Okay, so through fiber and phytochemicals in whole grains and legumes, vitamin E, which we find in nuts, seeds, sunflower seeds, pumpkin seeds, and then of course folate, vitamin C, and phytochemicals from your colorful fruits and vegetables. I did mention again nutrients like vitamin C, magnesium that can help prevent the oxidation of LDL cholesterol. And then there are certain bioactive compounds, again, for example, polyphenols in pomegranate, carotenoids, vitamin C, lycopene. Your lycopene is in your tomatoes, vitamin C, of course, in citrus fruits, tea polyphenolics in your green tea, polyphenols and oleic acid in your olive oil. So olive oil, really one of the main benefits of the Mediterranean diet, which I'll talk about in a short while, is attributed to the olive oil. So olive oil is very rich in monounsaturated fats, and it's really been shown to have such a positive effect on reducing or preventing cardiovascular disease. Of course, it doesn't, we can't just increase our intake of olive oil while still increasing our intakes of refined sugars. So it has to be a very comprehensive, management protocol. But I do want to mention something about olive oil and oils in general. And so it's really important that oils can easily be oxidized. Okay, so this is one of the main issues with oils. If they are not handled very well, if they are not stored very well, if they are um, heated at a very high temperature. So if you are, let's say, baking your sweet potato or vegetables in olive oil and it's at a high temperature, it can become oxidized. This oil can become oxidized, which really defeats the purpose of the benefits that are associated to olive oil or some other oils as well. So it's really important that we keep that into consideration, even those that are seen and believed to be healthy and that have been shown to be very beneficial in terms of heart health, and let's say anti-inflammation, etc. We really need to make sure that they are not, or they are managed in a way that does not promote their oxidation. Genistein, so soy is a very important source of um, phytoestrogens or genistein, for example. So soy is part, of course, or going for organic soy because a lot of soy nowadays is genetically modified. So it can also have a very heart protective effect. And in this case, it can help prevent the oxidation of LDL cholesterol. Endothelial function is so important. So when we speak about endothelial dysfunction, that really increases the risk of cardiovascular disease. So again, your grapes, which are rich in anthocyanins, catechins, flavonols, quercetin, your vitamin C coming from your grapefruit, your lemon, your orange, even the peel. So once you've squeezed the lemon or the orange, you can use this peel. You can may let's say grind it, or you can have lemon peel, for example, in your water, in your salad dressings. So you can really make the most out of the whole fruit in order to make use of all the nutrients in it. Omega-3 fats, again, I've got a special slide on that, and your polyphenols, going for nuts that are plain nuts, as opposed to your salted, your roasted nuts. Okay, so plain nuts are really superior. So all of these foods, I'm not sure if you're hungry yet with all these food photos, but they possess such strong anti-inflammatory, antioxidant functions, which can really be very heart protective. So all of these foods can work to protect heart health in a variety of different ways. So omega-3. So we know that EPA and DHA are really the important types of omega-3s. We tend to find these in fatty fish. So just remember, smash, which is your salmon, mackerel, anchovies, sardines, and herring. Those are the main five types of fish that are really rich in omega-3. And we should aim to have at least two servings of fatty fish per week, at least two. So what's the importance of omega-3s? Well, of course, they possess antioxidant activity. They can help improve lipid profile, they improve HDL cholesterol. So really, this is one way to improve the good type of cholesterol that Emil mentioned, is to up our intake of omega-3s. Supplementation is also possible if someone is in a very inflamed state. If we're trying to bring down that inflammation, we usually go for supplementation as well. The dose is very individual. Some other sources of omega-3 actually are for vegans or vegetarians are walnut oil, flaxseed oil. So we can find a specific type of omega-3, which is ALA, in plant-based foods. However, our body does not convert this very efficiently to EPA and DHA. Okay, so of course we still find a lot of health benefits to these plant-based sources of omega-3s, but in terms of EPA and DHA, we don't really get that really strong effect from these plant-based foods. Algal oil is also a good supplement, a vegan supplement for those considering omega-3 supplementation. Saturated fats. So, this is always a question. Coconut oil, red meat. I can't see any of the questions yet. Sorry for that. So saturated fats have, been seen as evil over the past couple of decades. Actually, in the 1960s, 1970s, there were researchers who were saying, it's actually the refined sugars or the white sugar and the low fiber that is causing or that is increasing the risk of cardiovascular disease. But then all of a sudden, the conversation stopped being about sugars or carbohydrates and started being about fat. And this is where, a lot of research has been done to show that saturated fat uh, for individuals, let's say, who are at risk can be problematic, but it's really the type of saturated fat. So the source of the saturated fat, the type, so the carbon length, let's say, of the saturated fat, and the replacement of the macronutrients. So if you were to bring down your saturated fat coming, of course, from eggs, from dairy, from meats, what are you going to replace it with? Are you going to replace it with carbs? But what kind of carbs? Okay, so replacing dietary saturated fats with carbohydrates, particularly those that have a high glycemic index, are really associated with an increased risk of cardiovascular disease. So this is what the research has shown. It can increase triglycerides, it can increase the small, dense LDL particles. Okay, so the small being the riskier ones. But if we replace saturated fats with polyunsaturated fats, this can reduce cardiovascular disease risk. But remember, with polyunsaturated fats, we have our omega-3 and our omega-6. So both are important, but the omega-3 are really what shine, basically. The omega-6 are important, but unfortunately, we are consuming way too much omega-6 coming from vegetable oils. So we need to bring down our vegetable oils, our omega-6, bring up our omega-3. Okay, so really in terms of, heart health, saturated fat, there is a place for saturated fat. The American Heart Association recommends that 5 to 6% of total calories comes, that no more than 5 to 6% comes from saturated fats. Have the occasional red meat. Dairy, in some research has been shown that dairy could be protective in terms of cardiovascular disease. Okay, so again, the accumulation of short chain fatty acids can cause too much, of course, overconsumption of red meat can lead to that chronic low-grade inflammation, which can promote insulin resistance and dyslipidemia. So this is, I talked a little bit about oils. So once they're oxidized, this is really where, and they become oxidized when they are exposed to heat. So when they are exposed to heat, okay, so when they are exposed to heat, the content of antioxidants comes down, and therefore they're oxidized. And the more we use them at home, so when we open and close that bottle of oil, it's becoming oxidized. Okay, so if it smells weird, if it tastes greasy, moldy, if it smells funny, avoid it. Okay, for olive oil, go for cold pressed virgin olive oil in order to avoid oxidation. Actually, I just remembered also a note about fish oils. Even your fish oils, if you do not store them very well, they can become rancid as well. So what you can do is you can pop a pill open and you can smell it. Okay, if it smells off, you've got to throw that bottle away. So the Mediterranean diet, which emphasizes plant-based foods, fruits, vegetables, cereals, beans, nuts, seeds, olive oil, and it's reduced in red meat. It's got low to moderate amounts of fish, poultry. So the Mediterranean diet is really seen to be the preferred diet or way of life or way of eating to reduce risk of cardiovascular disease. So it's high in omega-3s. It's low in terms of simple sugars, and it can reduce the risk of type 2 diabetes and improve insulin sensitivity as well. So it's really the antioxidant properties of these plant-based foods that can really promote health of the vascular system. So the benefits of Mediterranean diet, it can help reduce blood pressure, improve insulin sensitivity, as I mentioned, improve type 2 diabetes, reduce oxidative stress, increase nitrates, reduce homocysteine, and improve lipids in general. So in the PREDI-MED study, which was conducted in Spain, and so basically the study was to show the effects or the benefits of a traditional Mediterranean diet on cardiovascular disease. And it showed that in general, myocardial infarction, cardiovascular disease deaths were reduced by 30%, with eating more nuts and consuming more extra virgin olive oil. Eating whole grains. Okay, so even having an extra 1 to 2 servings of whole grains can reduce your cardiovascular disease risk by 10 to 20%. Whereas if you have an extra 1 to 2 servings of refined carbohydrates, that can increase risk of CVD risk or increase CVD risk by 10 to 20%. The DASH diet was developed particularly for individuals with high blood pressure. So it emphasizes, foods rich in magnesium, potassium, calcium. It's very rich again in plant-based foods, and it's reduced in dairy foods. It's reduced in meat-based foods. It also promotes physical exercise, and of course, one of the main aims is to reduce intake of salt. So again, by controlling blood pressure, we can significantly reduce risk of cardiovascular disease. And in the nurses' health study, this showed that a 14% lower risk in those individuals who followed the DASH eating plan the most. Vegetarian diets, again, those are reported to have a lower risk of, death from ischemic heart disease. They tend to be richer, of course, in polyphenols, phytonutrients. They tend to be higher in micronutrients like magnesium, folic acid, vitamin C, E, but they're likely to be lower in zinc, vitamin B12, vitamin D, and calcium. Vegetarian diets, vegan diets can also be unhealthy. So if someone is relying a lot on refined sugars, then that's not necessarily a good thing. Okay, so I will talk about supplementation as well. Red yeast rice being one of the most common supplements or ways to naturally reduce cholesterol levels. So it's actually been shown to help lower total and LDL cholesterol. It doesn't really have an effect on HDL cholesterol. It could possibly reduce triglyceride levels. It can improve blood pressure, and it can improve systolic blood pressure. It's really important that if you do go on red yeast rice to make sure that you're following up with someone who is knowledgeable with using red yeast rice, because it does have some side effects, and it works in a similar way to statin. So it's believed to work like statin medications, on a milligram to milligram basis. So, some of the side effects that can happen is that it can increase liver enzymes, it can cause gastrointestinal distress, and it can lead to myalgias or muscle pain and weakness. And it can also reduce coenzyme Q10 as well. So statins, so just a word on statins. So statins, like your Lipitor, for example, in general, medications can interact with one another, but then they can also deplete micronutrients. Okay, so in this case, statins reduce coenzyme Q10, vitamin A, vitamin D, B vitamins, magnesium, zinc. So it's really important to keep that into consideration. And red yeast rice, can also deplete things like CoQ10. If you are taking red yeast rice, it's also important to watch out for your green tea intake and your grapefruit as well. Berberine is so common in insulin resistance management. So we did speak about that before. So it grows in Asia, Europe, and it can reduce blood pressure. It has an anti-inflammatory activity, antibacterial effect, antifungal effect, and it can lower blood cholesterol in a similar way to statins. So it can reduce blood cholesterol by 20 to 30%. It does have some side effects. Again, gastrointestinal problems like constipation or diarrhea or nausea. So please, again, not to be supplemented alone. Plant sterols and stanols are super important when we talk about managing blood cholesterol levels. So they are found in a range of plant products, fruits, vegetables, cereals, nuts and seeds. They're in a way, their molecular structure is similar to cholesterol. The proposed mechanisms in which they work is to bind to cholesterol, therefore preventing its absorption, but it can also act at the liver level. Remember, the liver is responsible for producing cholesterol. It can inhibit the production of endogenous cholesterol. So it can help reduce LDL cholesterol, and it doesn't have an effect on the good HDL cholesterol or even triglycerides. So plant sterols, stanols can be found naturally in plant-based foods. A lot of foods nowadays are also uh, fortified with sterols, like your margarine. I wouldn't say that's necessarily a healthy option, but you might see sterols, stanols added to certain foods, and of course they're available in supplementation. Fiber, okay, remember fiber food first, but sometimes we may support again giving someone extra fiber in their diet. So psyllium, beta glucans, glucomannan, those are fantastic sources of soluble fiber, which can bind, cholesterol in the gut and therefore make it less likely to be absorbed. Okay, so remember that anytime you increase your fiber intake, particularly if you're taking it in supplementation form, you really need to increase your fluid intake in order to produce that gel-like compound. So soluble fiber produces like a gel-like compound which absorbs the cholesterol. Okay, so some side effects, again, is fermented. We cannot break it down. We cannot digest it. It goes through our digestive system intact and then it reaches the colon where it gets fermented. So it can be, a trigger for bloating, gas, constipation, maybe even diarrhea. Okay, so the soluble fiber, we can find it in oats, which is a fantastic source of soluble fiber, barley, and then beta glucan supplementation as well. Spirulina, there is some evidence to show that when it's given for 1 to 2 months, it could reduce LDL cholesterol levels and total cholesterol levels. Again, it's how it does so, it's still not known, but it does show some promising effects. Okay, getting there. So we really cannot talk about approaching cardiovascular disease holistically without addressing stress, which Amal did, exercise, sleep management. So exercise, these are the American Heart Association, is 150 minutes per week of moderate to intense aerobic activity, or 75 minutes per week of vigorous or really strong aerobic activity. But really, it's just to start, okay? Increase gradually, see what's best for you, depending on your lifestyle, depending on accessibility to it, whether it's a gym or outdoor area for walking, but start. And every little bit counts. Okay, so even if it's twice a week for 30 minutes, it's a gradual build-up. The American Heart Association also recommends moderate to high intensity muscle strengthening, or muscle or resistance training. Okay, so also as Emma pointed out, the importance of muscle mass as well. So build it up over time. The more, the better. Sleep. So again, sleep deprivation. We speak, I think, about sleep and stress at every single presentation, but it's so, so crucial. Individuals, and this is American Heart Association news, those who slept for less than 6 hours a day, metabolic syndrome was just more likely to be common in these individuals. So and it's important to follow our circadian cycle, our circadian rhythm. Okay, so sleeping for 7 to 8 hours, but going to bed earlier, 10, 11, waking up 5, 6, 7, as opposed to going to bed at 12 or 1 a.m. and then waking up at 9 a.m. So it's really important to focus on good sleep, sleep in a dark room, avoiding screen time at least an hour before bed. And sleep apnea is so important to address, okay? Whether you are aware of it or not, if you suspect it, please undergo a sleep study. Sleep apnea can drastically increase the risk of cardiovascular disease, okay? Whether it's stroke, whether it's in general myocardial infarction, sleep apnea is really important to be addressed. So the take-home messages is cardiovascular disease is very multifactorial. We need to focus not only on lifestyle measures, but things like hormone imbalances. We need to focus on environmental toxin exposure. So smoking being one of them, exposure to toxins, whether it's heavy metals, whether it's, our beauty care products, xenoestrogens. It's important that we also focus on, again, thyroid conditions, in menopausal women, again, hormonal imbalances. Please do consider getting, particularly if you have a family history, of heart disease, please do consider getting a comprehensive lipid profile. Weight management, I didn't emphasize that so much, but it's really, it's key. Okay, so even losing a couple of kilos can significantly reduce cholesterol levels as well. Okay, or can improve dyslipidemia. So, and it's not only BMI, it's where is this extra adipose tissue centered. Okay, that visceral fat, abdominal fat is really very, it increases the risk of chronic conditions. Look at waist to hip ratios, which should be less than 0.9 for women, for men, and zero point 0.8 for women. Waist circumference, again, less than 80 centimeters for women, about 94 centimeters for men. And then incorporating everything that I spoke about. Okay, so all these phytonutrient-rich foods, functional foods, bioactive components, your fruits, your vegetables, your soluble fiber, your nuts, your seeds, your omega-3s. Don't, underestimate the importance of oral microbiome, gut microbiome, in preventing chronic diseases. Again, addressing exposure, toxin exposure, and finally, to move more, stress less, and sleep better. So thank you so much.